Well, we're back with Dr. Patel. Dr. Patel, you talked about the missing teeth and how they can affect the whole structure of the face, looking crooked, even getting tensions in the neck, not sleeping well, or waking up with tensions, headaches, and all that stuff. Now, what are the major ways of fixing missing teeth? I know there's many of them out there, and the technology has advanced. Tell us about it.
Well, missing tooth can be replaced in many ways, but the most important one which we use and which is very, very famous with the dentist and very, very approved, too much approved by the patients, is the implants. The implants is the first choice of replacing a missing tooth. The implants is a small titanium rod which is screwed into the patient's jaw. And we have to wait for about 3 months at times. Nowadays, we load the implant immediately also. And once we wait, it integrates nicely, and a tooth is placed on the implant for the missing tooth. The second choice is a bridge. A bridge is between two abutments, but in the bridge, the main disadvantage is that we have to trim the adjacent teeth. Once we trim the teeth, that means we are using the natural teeth, and I would prefer implant to the trimming of the natural teeth. And the second disadvantage is that the patients cannot clean and floss very nicely. Though there are floss threaders and other aids there to help to clean it, but it is very difficult and very time-consuming to clean under the bridges. So again, we'll go to the implant as the first choice. The third choice is the partial dentures or metal partial dentures. The main disadvantages with them is that they've got metal clasp. The metal clasp will go around the teeth. Every time you take out the partial, you put in the partial, the clasp glides around the teeth, and that way the tooth becomes loose in the long run. If the clasp is activated beyond its normal terms, then you will be losing the adjacent teeth. And of course, during the normal day-to-day life in a restaurant and all that, you have to go to the restroom quickly and clean all the food which gets under the partial dentures and all that. The fourth way is a plastic partial denture or what is known as flaxite partial dentures. It covers more area of the tooth structure, more taste buds are covered, and again the disadvantage is that it should be really tight. If it is not tight, it will be loose and wobbly in your mouth. So these are the ways of replacing the missing teeth.
I got it. So when you let me ask you something about prices also a little bit. People are very afraid of implants being very, very expensive. Now, when you do a bridge, meaning when you do one tooth, you really need to fix 3 bridges, basically 3 crowns or 3 caps. So if you consider that versus only doing 1 tooth in between, is the price really a huge difference? Between one bridge in order to replace one missing tooth or one crown, or one implant?
Well, there is not much of a difference. It may be just double the cost of a bridge. A bridge is made up of different materials. We use non-precious metal, we use precious metal, we use semi-precious metal, or we may use zirconia, or we may use old porcelain bridge. The price would depend on that. The highest price may go to $2,500 or so in our office, and the implant would go to $2,500 to $3,000 itself. So the price is not much of a difference. It is the way of life after a bridge or an implant is placed that makes the difference. So the way of life is much more better and as norm or as natural as possible with implant rather than with a bridge. So the price difference is very, very minimal.
Absolutely.
Because with the implant itself being a titanium rod and all that, we have to use a very high precious metal. We cannot be using a non-precious metal along with this. So that is a difference. That is the price difference.
Wonderful. And of course you also mentioned that when you have a bridge, which was a good way and is still a good way, but not anymore the best since implants became so good, the cleaning and the keeping the gums healthy around the area of the bridge is much more difficult, and thus with a bridge it's more easy to get a gum disease than with an implant, because the implant is easier to clean. Is that what you said?
Yes, that is very much so. Around the bridge we have to use cumbersome way of cleaning with the floor spreaders, mostly floor spreaders, and when we use that, a patient has to take a needle and an eye type of a unit which is called a floor spreader, take it around the bridge, sew through underneath the bridge, bring the floss in the hand, and then clean it, and then he has to go to the adjacent teeth and do the same thing. Now this is very cumbersome and time consuming, so patients do not have time. With an implant it is very easy, and also in a bridge, most of the bridge will go off failure after a while if it is not cleaned around the area very well, because if the bridge is not sealed very well, the tooth can get decayed, and once the tooth gets decayed, you have lost the tooth. And also the patient has lost, you have to see the psychology here, the patient has lost the tooth because of his bad habits of not cleaning around the teeth, and number two, because of the probably gum disease. So those same habits are still there with the patient. And adjacent teeth may have huge fillings, and underneath the huge fillings, there may be recurrent caries happening, and we do not know what's happening. So there is another way of failing a bridge.
Right. And obviously, just even if a patient does take well care of the bridge, does the implant have a longer life than the bridge?
The implant could be as long as you leave, probably, once it integrates and once it is in the mouth and once you keep it nice and good clean. You maintain it nicely with us, with the dentist, and then the implant can last you all your life. The bridge, we used to give about 15-20 years lifetime for the bridge. The implant we may give 30-40 years.
So
that's how it may last.
So right there, the few $100 an implant might cost more comes right back by it lasting a tremendous amount of more longer time. Never mind, as you mentioned, the other health hazards by having a bridge. That's wonderful. Well, yes, Dr. Patel, thanks for letting us know about all that. We'll talk more to you. Bye-bye.
Well, thank you, Albert.